Hello guys, hey, welcome back to Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. It's been a while since my last live. Most of you guys already know, but the ones that are joining and don't know, I just had a baby. He's 3 weeks old. Everything went fine. So that's the reason why I've been a little away in the last few weeks. The last few weeks postpartum and pre-baby, and then the 3 weeks that the baby has been here. But since I'm feeling a lot better and I've been missing you guys so much, I decided to start doing the lives again. So today's gonna be our first live back, and because it's the first back in a while, I decided to do a topic that it's a little bit more broad, to have more time for questions and answers, which I think it's one of the things that you guys like the most and I enjoy the most too, because it's getting to know us better and also targeting what you want to know. And since it's been a while, I know that there's a lot of questions out there, so we'll talk about how to get a consultation, because this is a very common question, very common DM that I get on social media. After you guys see my page and after you guys see my work, is how do I get a consultation with you? So I'll go over it and then we'll jump into questions, okay? So the easiest way is through our website, okay? pureplasticsurgery.com is our website. You can find a link in my Instagram, in my Facebook. All my social media pages have a direct link with our website. But if you just Google Pure Plastic Surgery, is the first thing that will pop up. It's pureplasticsurgery.com. Once you hit that, this is the page that you'll see with our logo in the center, and right in the top corner says virtual consultation. That link, you click it and it'll open up this form. That's the easiest way of getting your information in the system and for me to evaluate your case, okay? There are some things that you might think that you need or you want, but once I evaluate your case, I might say, well, with your goals and the things that you want to do and you want to get to, it's better to do this and that. And that is why it's better to fill in this information, okay? What is the information that we require there? It might be a lot for some people, but it's the necessary information for me to give you my recommendations, okay? Remember, I'm not seeing you in person, so there are a lot of questions that I need to address first in order to answer and to give you a safe and valid recommendation regarding your surgery, okay? So the first part is just demographics, okay? Your name, your email, phone number, contact information for us to reach back to you, okay? Then it jumps up to some past medical history, okay? Medical conditions, medications that you take, surgeries in the past. It also asks about medications that you're in. If you smoke, smoking is a very important question. Why? Because smoking increases your peri-op complications, not only anesthesia related, lungs, heart complications, but also wound healing complications. And even with liposuction, right? We're thinking, oh, but liposuction doesn't have too much wound healing to happen. It's just small incisions. Well, it's actually a lot of wound healing because I'm doing a lot of surface area, and if the skin doesn't have good blood supply, which is what happens with smoking, the little vessels in the skin don't work very well. You can end up having fibrosis or necrosis complications. Blood supply doesn't get very well. So the smoking question is a very important one. I do perform surgery in smokers, but I'm gonna ask you to stop smoking at least 30 days before the surgery. If you can do 2 months, that's the best, okay? 2 months is the best to clear your body, not only in your system for the wound healing part, but also very importantly for your lungs to tolerate the general anesthesia and for you to recover well from that, okay? So if you can do 2 months, that's perfect. And remember, the day of your surgery, I'm gonna do a couple of tests in your urine, and that is just to keep you safe, right? To make sure that you are optimized as much as possible for surgery and we decrease all of the complication rates as much as possible, okay? One of those is nicotine level in the urine, okay? If that is positive, most of the time we'll have to postpone the surgery, okay? So remember, that is a very important question. And if you're a smoker, it's not like I'm not gonna do surgery, but you'll have to adjust for the period of before the surgery and also for the wound healing part after the surgery. After filling all that information regarding your past medical history, it jumps for the pictures. The pictures are extremely important, okay? I recommend doing at the least underwear possible, okay? Especially if you want, like for example, if you want to show me your abdomen for a tummy tuck, and then you put an underwear that it's high rising and I can't see your belly, I can't give you a good recommendation, right? And I understand it's a little bit uncomfortable to be sending pictures of your body, but remember, this is HIPAA compliant, protected. It's gonna go to a system that it's all protected. So your pictures are that's why I don't want you to be sending me pictures through Instagram, Facebook. That's not the way of doing it, because that's not protected, okay? I'm trying to protect your safety. So the way of doing it is through our system, and that is HIPAA compliant, protected, okay? So try to show me the areas that you want me to see, okay? Sometimes some people also blur the nipples. I know the nipples, it's uncomfortable to send a picture with the nipples, but the nipples for a breast procedure are extremely important for me to evaluate if you need a nipple reduction, areoloplasty, or reduction of the areola, okay? So all of these things are important for me to give you a recommendation, okay? The first pictures that we're gonna ask is at least 3 views, okay? It's gonna be a front view, okay, of the area that you wanna address, okay? So usually it's the entire body, but if it's the face, if it's the back, okay? So try to take the pictures at 90 degrees from the area that you want it to evaluate, okay? So if you want me to evaluate your face, for example, don't take the picture at the level of your breast, okay? The picture should be, or the camera should be at the level of the area that you want to address, okay? Why? Because if you put it down or up, it's in an angle and it changes the area that we're evaluating, okay? So it is extremely important to be right like 90 degrees from where you want to evaluate, okay? So if the area of evaluation is the belly, it's not at the level of your face, okay? The picture should be, or the camera should be at the level of your torso or your trunk for me to evaluate your belly, okay? The underwear, try to lower it, okay? So I can see the lower fold at least, okay? If you want to do naked pictures, that is okay. If you want to blur your genital area, that's okay. But try to keep it very low so I can see this area, okay? Low enough for me to evaluate the crease, okay? The other picture is a 45 degree, okay? So it's like this, angled, okay? That allows me to see the angle and also folds that form, okay? Also in the breast, it allows me to see half of one breast and then the angle on the other, okay? And that is important for both sides, okay? Not only one angle, but 2 angles, so I can see both sides, okay? And then it's 90 degrees, so all the way on the side, okay? Not angle like this. Try to keep your torso straight and the camera 90 degrees from your torso, okay? All of those pictures are extremely important, like I said, okay? Again, I'm not evaluating you in person, so the more information that you can give me, the better evaluation I can do and the better recommendation, or the most straightforward and direct recommendation I can give for the procedure that you want to do, okay? After the pictures, it's just more information, a little bit more information regarding the procedure that you want to do, the doctor. So this is the pure plastic surgery page. So okay, so one of the questions is going to be if it's Dr. Earl or me that you want us to evaluate. So you can put both, but then you have to click one of us, so one of us is going to do the evaluation, okay? If you want to then, after that evaluation, if you want to get a quote from both, that is also possible, okay? The coordinator will help you with that, okay? So again, first step is filling all of this up, okay? Try to not leave anything blank, okay? You might think it's not important for your specific procedure, but remember, maybe you're asking about a tummy tuck and my recommendation is going to be liposuction, or the other way around, okay? So it's important to fill everything as much as possible. I have all the information and I can give you a recommendation, okay? Once I evaluate, so once you fill this in, okay, give us 5 to 7 business days, okay? I have to evaluate this, okay? All of the people that, just imagine, all the people that come in and fill this on, send the pictures, I have to sit and read all over this, okay? Read all the medical conditions, check the pictures, check what they want to do, and give my recommendation. Once I give my recommendation, then a coordinator is going to be reaching out to you, okay? Once a coordinator reach out, then the communication is mainly like phone, the phone that you put, but also they're going to start using our HIPAA compliant messaging system, which is Clara, okay? So you'll get familiar with this after the coordinator starts the process, okay? Why Clara is so important? Again, let's go back to the safety part that I talked about with the pictures, okay? All of the information that we're putting here is, it's from your medical record, your pictures, all of that, it needs to be protected, okay? So that is why, and there are a lot of people that ask me things through Instagram, and my response is always gonna be check your Clara, okay? The reason why I do this is to protect you, okay? And me, okay? I need to protect my license, and also I need to protect your information, okay? It's not that I'm trying to not answer your question or go around it. That's the main reason, okay? So Instagram, Facebook is not a good protected forum to answer your medical questions, okay? So we go back to Clara. Clara is, and it's a website, so you can reach it from your phone and everything, and then it's an app too. It's very easy. It's like a messaging system. So it's very easy to send messages, to send pictures. That way you're gonna have your coordinator reach, and once you pick up the date and put down your deposit, then you're gonna start meeting a lot of new people, okay, from our team, okay? Because the next step, okay, once the coordinator, so let's go back to the virtual consultation form. I evaluated, coordinator reaches, says, Dr. Vidal thinks you're a good candidate for this and that. You're good. She can answer a lot of your questions, okay? So she's like, okay, but what about this? Can I add this? Can I add that? Your coordinator is gonna be your go-to person to answer all of those questions, okay? She's gonna send you a quote, including the things that you discuss with her, the things that you wanna add, the things that you don't wanna add, all of it, okay? If you want to do several procedures, several things that can be also, she can give you different quotes regarding that. And once you choose the date, and the date, it's with her too, okay? I also receive a lot of messages through Instagram saying, if I have availability on X or Y day. I have no idea, okay? I don't control my schedule. The girls control my schedule. So I don't know is the real answer to the question. Again, I'm not trying to avoid your question or answering it. It's the real answer is I don't know. So the girls know, okay? The coordinators are the ones that put the dates on my schedule. So they're the ones that are gonna know if I have availability or not an XY day, okay? Once you pick up the date, it's a 20% deposit down, okay? And then 45 to 60 days before your surgery, okay, that's when the pre-op coordinator is gonna call you and reach out to you, okay? Why? Because the medical clearance and all the things that you need to do to prepare for the surgery, she's going to be the one that answers all of that, okay? Including what labs you need to do, what workup you need to do. If your primary care, you need a clearance, if you need a cardiology clearance, if you need an endocrinology clearance, if you need any other labs, any x-rays, mammograms, anything. She's the one that's going to answer all those questions depending on the procedure, your age, and your medical history, okay? The other thing is she's going to explain to you also the dates, okay? Common area of anxiety is like, when do I do all of this and when do I need to submit all of this so I don't miss my date? She's going to be the one that's going to answer all those questions, and she's going to keep following up with you to make sure that you give everything on a timely base and we have all your labs and everything for anesthesia and me to clear, okay? So once you submit all your labs and medical clearance and x-rays, mammograms, anything that you need for your particular procedure, because it's depending on the procedure, your age and medical history, okay? The things that you need to submit. Once we have all of that, then I evaluate your chart and anesthesia evaluates your chart to make sure that everything is in order for you to go with the surgery and to receive general anesthesia, okay? So that's basically the process, okay? I'm gonna definitely do another live about the medical clearance part, okay? So that's an area that it goes into a lot of detail depending on the age, the procedure, what things I ask you to send in and why. So we can do that next week or the following regarding what is it that we need to send in. But basically that's the process, okay? And like I said, the easiest way, website, virtual consultation, and the form, okay? And give us a little bit of time, 5 to 7 business days to evaluate and give you my recommendation, okay? I'll take some questions now if you guys have. Yes.
We're gonna start doing Spanish live.
Yeah.
Every other Friday.
Awesome. So, vamos a empezar también a hacer unas lives en español, así que vamos a estar haciéndolo un viernes sí y un viernes no. Así que pendientes a mi página para saber cuándo vamos a empezar a hacer eso, ¿ok?
Okay. Well, there are many compliments. You look so good for just having a baby. That's the first one.
Thank you so much.
Okay, this is Anna. And she said, I had a mommy makeover, but I end up with a bowl. Can that be fixed? If so, what procedure do you recommend?
Okay, Anna, if you had a mommy makeover with me and you have that concern, please send us a picture through Clara and communicate through Clara, because a bulge can be many things, okay? I'll have to see the picture, evaluate, talk to you, see what's going on to give you a recommendation, okay? It could be scar tissue, it could be swelling, it could be many things, okay? So just reach out to us to answer your question, okay?
Okay, and if she's not your patient, if she's a new patient?
If she's a new patient, then just fill out a virtual consultation. This is the form, right? Like, go to our website, virtual consultation, send me your pictures, and I can give you a recommendation to see if we need to redo the tummy tuck, if it's liposuction, if it's scar tissue, and what is it, okay?
Okay, doctora, this is a patient. We have been talking a lot, María Fernanda.
Okay.
She asked in Spanish, but vamos a contestarle.
Seguro.
Doctora, a mí me da miedo los coágulos de sangre. Es todo mi miedo después de la cirugía.
Sí.
¿Cuál complicaciones hay en la operación dentro y fuera?
Ok, los coágulos de sangre son una complicación que puede ocurrir después de cualquier procedimiento quirúrgico que envuelva anestesia general, ¿okay? La razón es porque cuando ponemos bajo anestesia general, los medicamentos que nos ponen para dormir hacen que las arterias y venas se dilaten y que la circulación no sea constante, ¿okay? Cuando estamos moviéndonos, cuando estamos caminando, en nuestro diario vivir, las arterias y las venas están circulando constantemente, ¿verdad? Cuando estamos bajo anestesia, eso todo se calma, se dilata y no hay un flujo de circulación. También la cirugía te pone en un estado más, lo que se llama hipercoagulable por la inflamación, ¿verdad? Es un estado inflamatorio en el cuerpo, así que aumenta tu riesgo de tener coágulos. Y los días postoperatorios no nos vamos a estar moviendo como nos movemos usualmente, así que otro riesgo adicional para coágulos, ¿ok? ¿Qué hacemos para tratar de disminuir el riesgo de formación de coágulos? Nunca es cero, pero podemos bajarlo lo más posible para disminuir ese riesgo, ¿ok? Una es estar en tu peso ideal, en el índice de masa corporal, por lo menos debajo de 33.5, mejor si estás por debajo de 30. Por debajo de 30 el riesgo de formación de coágulos es mucho menor, ¿ok? Lo segundo es que depende del procedimiento, hay veces que, pues, específicamente lo que es la abdominoplastia o el tummy tuck, te vamos a incluir lo que se llama unas medias de compresión. Esas medias de compresión las vas a usar por 2 semanas luego de la cirugía y eso lo que hace es básicamente imita el movimiento del músculo para que la circulación esté constante, ¿ok? Lo otro que no importa la cirugía que vayas a ponerte, te vamos a poner medias elásticas que las vas a usar también por una semana. Eso no importa la cirugía, no importa si es liposucción, seno, tummy tuck, vamos a ponerte en esas medias para disminuir ese riesgo. Y lo otro que es lo más importante, a pesar de todo lo demás, es caminar. Yo te quiero caminando el mismo día de la cirugía, ¿ok? Y cada hora por 10 minutos para que mantengas ese movimiento y evitamos entonces la formación de coágulos.
Another compliment, I came here to let you know that you snapped the hell back. Good work.
Oh my God.
Okay, there's any chance that you discover an umbilical hernia in a tummy tuck?
Yeah, there's always a chance. Usually the tummy tucks, when I see you on the pre-op, I'm going to examine your abdomen, and most of the time I can tell if you do have a hernia or not. But there are some hernias that are very small, and if you have a large pannus or a large folding skin over it, it's unable to be palpated during the physical examination the day before. So yes, there is a chance that when I'm doing the tummy tuck, I find a small hernia. If it's a small hernia like that it's usually not noticeable on physical exam, it's usually very small, and I can suture it and fix it in the same time. If it's a large hernia that you have before the surgery and we know about it, it's gonna depend on the size of the hernia, okay? And that's why I'll let you know during the virtual consultation, when you send me the pictures and send me your abdomen, I can tell if it's a very large hernia. I'm gonna recommend you get the hernia fixed before the tummy tuck, okay? And then we do the tummy tuck, okay? The reason for that is because if it's a large hernia, you're gonna need a mesh, okay? Mesh, I don't put here. I don't do mesh surgery. That's a bigger surgery that a general surgeon should do, and it's usually covered by insurance that you do it on a hospital setting, not here. So you'll have to do it beforehand, have that healed, and then come back for the tummy tuck.
Hoy estamos en Spanglish. So, quiero hacerme un tummy tuck, pero me da miedo que la herida me cree un exceso de piel.
Okay.
¿Cómo lo puedo prevenir?
Sí, yo creo que el concern o la preocupación número uno para la mayoría de mis pacientes que yo les puedo recomendar una abdominoplastia es la cicatriz. Y lo entiendo, ¿verdad? Obtener una cicatriz en el abdomen, si la podemos evitar, pues la evitamos, ¿verdad? Pero hay situaciones en las que ya la piel está muy laxa, el músculo está muy débil del embarazo o de pérdida de peso, y necesitamos hacer otros pasos que no solamente se pueden hacer con liposucción, como es la reparación del músculo, remover el exceso de piel, y eso se necesita hacer con la abdominoplastia y pues con la cicatriz, ¿ok? ¿Qué podemos hacer para tratar de que la cicatriz sea lo más finita y lo más unnoticeable, o que no se note lo más posible, ¿ok? Uno es tratar de evitar tensión, ¿ok? So yo te voy a pedir que por las primeras 2 semanas estés caminando dobladita hacia el frente para que no le pongas tensión a la cicatriz, ¿ok? Número 2, vamos a empezar el tratamiento de cicatriz 2 semanas después de la cirugía. El tratamiento de cicatriz que yo recomiendo es basado en silicona, ¿ok? El que vendemos aquí se llama Silogen. Hay muchas marcas, hay muchos estilos, pero lo importante y por lo que yo recomiendo Silogen es porque tiene que ser un producto que sea 100% silicona. Muchos de los productos de cicatrización no son 100% silicona, y lo único que está demostrado que mejora la cicatrización es eso, ¿ok? Así que te voy a recomendar algún producto que sea 100% silicona, como es el Silogen, que lo comiences 2 semanas después de la cirugía. Y lo tercero es tratar de evitar rayos ultravioleta en esa cicatriz lo más posible, completamente por los primeros 6 meses y lo más posible por el primer año, ¿ok? Mientras la cicatriz coge sol, como eso está sanando y esas células están produciéndose más, absorbe más la energía de los rayos ultravioleta y se pone más oscura, ¿ok? Así que tratar de evitar y proteger, ponerte protector solar en la cicatriz y tratar de no tener luz ultravioleta en la cicatriz por el primer año es sumamente importante.
Ok, aspirina antes de la cirugía para evitar los coágulos de sangre.
No los recomiendo. La aspirina, en realidad, para evitar coágulos de sangre, lo que se necesitaría es un anticoagulante más fuerte que aspirina. Aspirina no va a ser suficiente. Aspirina puede evitar complicaciones cardíacas en una persona que tenga problemas cardíacos, pero no de formación de coágulos en las piernas. No se ha visto que aspirina disminuya la formación de coágulos en las piernas después de cirugía, ¿ok? Así que no creo que es necesario y aumenta el riesgo de sangrado perioperatorio, así que yo no recomiendo y yo te voy a pedir que pares todos los productos de aspirina y los no esteroidales como son la Aleve, Advil, ibuprofeno, Motrin, todo eso los vas a tener que parar antes de la cirugía y no los vas a tomar por las primeras 48 horas después de la cirugía por el riesgo de sangrado. El medicamento que se puede añadir para evitar formación de coágulos en las piernas se llama Lovenox, es un anticoagulante más fuerte, ¿ok? Eso yo únicamente lo utilizo en pacientes que tengan un riesgo moderado o alto de formación de coágulos, que la mayoría de mis pacientes no lo tienen porque yo no les voy a ofrecer cirugía si tienen los factores de riesgo que te va a llevar a eso, que es que hayas tenido coágulos anteriormente, que tengas un índice de masa corporal por encima de 35. Todos esos te hacen que tú seas alto riesgo de formación de coágulos. Y ahí es que está recomendado usar el Lovenox. Así que por eso yo en mis pacientes no lo utilizo porque yo no voy a operar a alguien de alto riesgo. ¿Estamos? Bueno, yo espero que les haya servido. Hopefully this information was good for you guys. This video will be in my Instagram, my YouTube page, Pure's YouTube page. So if you want to review what things to do, how to get a consultation, you can jump back into this. And I'm very happy that we had our time again, and I'm back, and we're gonna do it again next week. So I'll see you guys next Tuesday Tips with Dr. Vidal.
And one last thing, you're still receiving consultations?
I am, yes, I am. So even though I'm not doing surgery still, okay, I'm coming back next month, I'm still evaluating virtual consultation forms, okay, and I'm still available to answer questions through Clara, okay? So my coordinators are working still, and my advice is don't wait. October, November is almost fully booked. There are no dates available, almost no dates available October, November, and December is starting to look very busy. So if you want to get dates, don't wait until I'm back in October because you probably won't find a date until next year, okay? So check the virtual consultation form. Write us through Clara if you have any questions, and I'll see you next week, okay?